All right. Thank you. Bye.
Hello, everyone. Today we're going to be talking about something important, dental health. It's something that matters to all of us. I'm Fatima, and I'm excited to be your host for this live show. We've got a great show lined up. We'll be talking with Dr. Kumar Vadivel, also known as Dr. V. He's a super smart dentist who knows a lot about teeth. He's going to tell us about the newest things in dentistry, how to keep your teeth healthy, and ways to get dental care that doesn't cost too much. Whether you know a lot about teeth or just want to learn how to keep your teeth and your smile bright, you'll find something interesting here. We'll cover many topics like why brushing your teeth is so important and what's new in dental technology. We've already got some questions from you, our viewers, and we'll answer them. Plus, you can ask questions right here during the show. Before we start, let me tell you a little more about Dr. V. He's not just a dentist, he's a periodontist, which means he's an expert in certain types of dental care. He works at ToothHQ Dental Specialists in the Dallas-Fort Worth area here in Texas. And guess what? He even has a book coming out next year. So make sure you guys check that out. If you want to know more about Dr. V, check out our website at www.mytoothhq.com. So let's get comfortable and ready to learn lots of cool stuff about taking care of our teeth. Let's begin our dental live show. Welcome everyone, and now let's welcome Dr. V and start our show.
Wow. Look at your smiling face. I'm going to be competing with you on the smiling part here. Hi, everyone. I'm Dr. Kumar Vadivel, but you guys can call me Dr. V. I'm super excited to be here again with you all today. Let me tell you a little bit about myself, although Ms. Fatima already told you. I'm a board certified periodontist, which means I'm specially trained in taking care of gums and bones that support your teeth. I'm also skilled in dental implants and oral surgery. I'm part of the American Academy of Periodontology and American Board of Periodontology. That is a fancy way of saying I work with a group of dentists who are experts in gum health and dental implants. I started ToothHQ Dental Specialists, and we have 4 offices in the Dallas-Fort Worth area. We are all about making sure your teeth and gums are healthy and strong. Now, I'm here for you. I would love to hear any questions you might have about your teeth or gums. You can ask your questions live right now or even send your questions for our next show. Your questions help us really make these shows very helpful, not just for you, everyone who is watching around the globe. And one more thing, if you like what you're learning here, please let us know. Your feedback is super important to us. Don't forget to like or subscribe to our channel so you won't miss out on our latest and the greatest updates and helpful tips for your dental health. I'm looking forward to talking with you all and answering your questions, and let's make our smiles the best they can be. Right?
Yep, right.
Perfect. Yeah.
Well, we have a lot of questions today, Dr. V.
Fantastic.
Our first question is, it says, I am 31 with impacted wisdom teeth on both sides. There is no pain, but my dentist warns of nerve damage and losing my last molars during extraction. I'm thinking of delaying the procedure. Am I making the right choice?
If you have an impacted wisdom tooth, and whether that needs to be removed or not, and you can make the decision, and your dentist knows the reason why the tooth need to be extracted, so that is the reason why he is giving you the recommendation. And 2 reasons: one for preventive, and then the other one reason why you may have like something going on and with the last molar, and that is the reason why you will need to have the tooth extracted. But one of the precautionary things that we always tell our patients is, well, you may end up losing the tooth in front of that, the last molar, during the process of the tooth extraction, because of the way your tooth is positioned. It's not uncommon for us to warn you of that might happen, but not necessarily it is going to happen. So the reason you really need to have the teeth extracted, your dentist probably already explained to you, and definitely you are going to have the risk of possibly having some kind of a nerve damage, which could happen to anybody, not necessarily just in your case. Losing the last molar in front of that, like it could possibly kind of happen. But if you end up having some kind of a nerve damage, you may have either some numbness on the chin or the lip following the procedure, or you may have some numbness on the tongue or losing the taste on your tongue. These are not uncommon for you to expect any type of a risk during the procedure. And just because you are 31, it does not increase your risk significantly higher, although the longer you're going to wait or the older you are going to get, your risk is going to go higher. Whether you are going to whether you should delay or you should proceed, that really depends on what is going on, either with the impacted tooth or with the tooth in front of that. My recommendation is you discuss all of these above factors with your dentist and make a decision.
Yeah, I say get them out.
You got it. That is what we do here,
yeah.
Right? Yeah.
And come here to get them out.
You got it. Yeah, absolutely. Yeah. And again, speaking of what she's saying is, if your dentist has recommended, so you got a lot of options, so if your dentist is going to remove that, not that I don't know your dentist, not that, the dentist may not be comfortable doing the procedure or they don't know how to do this. And this is what we do as surgeons, and we do this all day long. And what is risky in the dentist's hand may not be as risky in our hands as surgeons. So find a periodontal surgeon or an oral surgeon and get a second opinion, and possibly you feel comfortable with the oral surgeon or a periodontist, or after you see the oral surgeon or the periodontist, you may feel again comfortable with your own dentist, and then you make it a decision, informed decision.
Yep.
Okay.
All right. We have another question. This one says, Dr. V, can oral thrush lead to gum damage? That's a good question.
Absolutely. The oral thrush can lead to gum damage. The oral thrush is nothing but a fungal infection. The fungal infection can cause irritation, redness, swelling of the gums, and even in severe cases, it may even lead to sores or like severe ulcers that can affect the gum health. So it is very important that you treat your oral thrush very promptly to prevent complications, including gum damage.
Good stuff. All right, our next question is, I've had implants placed on both upper and lower jaws, and I also have Sjogren's syndrome. The teeth are made of plastic and glued in, but they keep cracking at the gum area, and now 2 of my front teeth have fallen out. Why are there so many issues despite spending $40,000? Is there anything that can be done to fix this? Absolutely.
There is always a fix for everything, right? Yeah. So going back to your question, Sjogren's syndrome, if other people, they may not know, people suffer from dry mouth, and it is because of reducing saliva that protects your teeth and gums. So this dryness that you have because of the syndrome that you have or the disease you have, weakens and the adhesives and makes the plastic that is made, your teeth are made of, they make it more crack prone, or it makes it failing, and because you accumulate like a lot of plaque, and the plaque does not get washed away, especially near the gum line where there may be like a lot of plaque, and then there are calcium deposits, and then they may be releasing a lot of chemicals. The bone and tissue health may get also affected, impacting the implant stability. So to answer your question, the plastic, why is it keep breaking? Because of all the above factors. So for better results, you can talk to your dentist about possibly making these prostheses made with a stronger material like ceramics or zirconium. Nowadays, most of the prostheses are made of zirconium. They are all kind of what we call it as a made or milled in the lab, in the dental lab, in just kind of a one piece, which is going to better help you manage the dry mouth, or even if you have minimal saliva, you don't have the problem of these chemicals kind of affecting the plastic to make your teeth fall out. And then also other thing you can do is, if you want to try the existing prostheses, or if you want to repair that, try some saliva substitutes, or make sure that you are going to go for regular checkups and possibly discuss with your dentist your options, and they should be able to help you.
Okay. 40,000 is a lot of money.
It is a lot of money, but you don't want to end up making those implants or the prosthesis fail, because it is a lot of money.
Yeah.
So you want to still go see the dentist and discuss your options. Absolutely. Yeah.
Yes. Okay. Our next question is, can taking antacids for a long time damage tooth enamel, especially on the inner side of the tooth?
Absolutely. Yes is the answer. Long-term antacids, or like taking the gastric reflex medications, can indirectly affect the enamel, and it is usually caused by the rebound of the acid. If you could imagine, when you have acid reflux, you're going to constantly be burping, or even when you lay down, the acid is going to come into the mouth. That's what we call it as an acid reflux, and the acid comes back into the mouth. So it is a hidden reflex, and which is what we call it as the GERD, or the gastric esophageal reflux disease. Can expose the inner surface of the teeth to acid because of the acid coming into the mouth. This acid erosion can often start on the tongue side of the teeth, which is usually like on the inside, either on the bottom or on the top teeth. Some chewable antacids, or these acid reflux medications, contain some sugar, and that can cause some cavity, although nowadays the tablets have gotten better. Dry mouth, which is a side effect of the GERD, can also reduce the enamel protection because your mouth is dry all the time. So the simple answer is, get your regular dental checkups done and make sure that you are going to catch the enamel wear sooner than later.
Yes. All right.
Okay, go ahead.
This one says, I am 60 years old and diabetic. I've been advised to switch to implants. Are all-on-4 dental implants truly worth the discomfort, pain, and cost? I'd appreciate an honest opinion.
So two things that you said, 60 years old and diabetic. Those are absolutely not a concern anymore at all. Age is not a concern, because we do this on a very regular basis on older adults, and my oldest implant patient is 102. So we do this all the time. My oldest all-on-4 patient is 86 or 87. So age is not a concern. What about diabetes? Diabetes is not a concern unless you are an uncontrolled diabetic. So a lot of times when patients come into our office and they don't know they are diabetic, or they don't know how controlled their diabetes is, so we kind of do the prep work, and including sending them to the doctor to get them checked out, to check their health and check their diabetes, and check what we call it as an A1, the HbA1c. The A1c level is to see how good their diabetes control is, to make a decision on whether they are a good candidate for the all-on-4 treatment or not. So whether it is worth the discomfort and the pain and the cost, absolutely worth the pain. Absolutely, although I'm going to say pain, rather we say the discomfort nowadays, and we got lots of ways to manage the pain and the discomfort after the procedure. We are going to give you a lot of antibiotics, regular pain medication, stronger pain medication. We are going to give you a lot of healing gel, soft diet instructions, and ice pack instructions, and using the mouthwash correctly, how to take care of your mouth and the entire body, keeping yourself hydrated properly. All of these things are going to come with the surgical procedure, post-operative instruction, which is going to minimize the discomfort and the pain you're going to be in. Cost, absolutely. So we got patients all the time doing this procedure. And earlier, if you've been watching the show, Fatima said it could be up to about $40,000 or $50,000. And if you do one side, $20,000 to $25,000. And if you do two side stop on the bottom, it is $40,000 to $50,000. It is absolutely worth considering the long-term benefits because the implants are going to fully restore your function, improve your appearance, and enhance your quality of life, and pretty much like improve your confidence. And the success rate of all on four is really good, very good nowadays, and they got a very good success rate as long as you take good care of them. So definitely consult with the periodontist or an oral surgeon. It is crucial to discuss the risk versus the benefit, considering the thinking that you have, whether you're older or whether your diabetes is under, whether it is going to affect the implant. And so talk to them, and then they definitely will be able to give you a honest opinion.
Yeah, I think you should talk to your dentist, or like he said, a periodontist, because they're the specialists.
Thank you. Yeah.
All right. So our next question is, can gum disease be cured at home without a dentist's help?
The answer is for the most part, right. So mild gingivitis, which is a mild form of gum disease, can improve with very good home care. So a lot of time when you have mild inflammation or some bleeding around the gum line, it could be a beginning stage of the gum disease, or what we call it as a gingivitis. It can be taken care of very easily with brushing twice a day, flossing twice daily, and using an antibacterial mouthwash, over-the-counter mouthwash, which is going to help also. But you get into trouble, or you get into what we call it as a non-reversible or irreversible gum disease when you get some advanced gum disease, or even early stages of the gum disease, which we call it as a periodontitis, which needs a professional cleaning. So tartar can be removed, which is the reason why you get periodontal disease, and the tartar can only be removed by a dentist or a hygienist. So that is why you need the professional help. Delaying the treatment can only lead to more bone loss, more gum damage, and going to make you end up losing your teeth. So do not delay it. Home care is vital if you are in the beginning stages of the periodontal disease, which we call it as a gingivitis, but there is absolutely no cure for our home care cure for the advanced stages of the periodontal disease, or the deeper diseases, or serious or the significant disease. Consult with the periodontist or your dentist, and they should be able to help you.
Okay. All right. This question is, I've heard about a vaccine for tooth decay. Does it also work for gum disease, since both are in the mouth?
Fantastic question. Tooth decay and gum disease, they both involve two different bacteria. So if you're thinking that you got a vaccine for cavity and you are covered for the gum disease, you are not. If you thought you got the vaccine for gum disease and you are covered for tooth decay, you are not covered. Having said that, as I said, we got into the fine details. The cavity is caused by a bacteria called Streptococcus mutans, and the bacteria that causes the gum disease is, we call it as a P. gingivalis or T. forsythia. So those are the two main, or there is another one called AA, actinomycetum, and so I don't want to get into like the jargons here. So the decay for a vaccine targets cavity causing bacteria only, and it won't protect against the gum disease directly. And although there is no separate vaccines available for either one of them, although we got some cavity vaccines that are in place now, there is a lot of research that is going on for the gum disease vaccine. So when it comes, we'll be announcing the whole world.
Yeah.
Come get the vaccine so we can prevent the gum disease. So keep watching our YouTube channel. So we'll be announcing it first right here.
Yes. We have some live questions, guys. So let's get to the live questions. All right. So our first live question is, Dr. V, why is my pediatric dentist strongly recommending treatment for my 5-year-old son, undeveloped jaw?
Oh, great question. So you got a 5-year-old son. The 5-year-old son has what we call it as an underdeveloped jaw. So what that means is the jaw, if you see here, it is grown like to the side, the top and the bottom. And his jaw may be one either underdeveloped on the top or underdeveloped at the bottom. So now your dentist or the orthodontist is recommending some kind of a braces to be put on. And the reason that the braces or the treatment to be done at a young age, because if you do what we call it as an interventional orthodontics or an interceptive orthodontics, let's say for example you have an underdeveloped upper jaw, so they're able to put what we call it as an expanders to expand the upper jaw to come fit the bottom jaw. Let's say that your bottom jaw is underdeveloped and they can put some what we call it as a headgears or some kind of a braces and to push the jaw forward to come meet the upper jaw. So then later on the treatment is not going to be complicated, and later on you can avoid some extensive and expensive jaw surgeries. So to answer your question, yes, your 5-year-old son will need some kind of a braces. Yes, whatever the dentist is recommending is the right treatment, which is what we call it as an interventional orthodontics or the interceptive orthodontics.
At 5 years old.
Absolutely, yeah.
All right. We're going to get back into our regular questions. So this one says, I had my wisdom teeth removed a year ago. Is it possible for them to grow back? I'm feeling something sharp near my gums.
No is the answer.
I wish teeth did grow back, not wisdom. But
yeah. So no is the answer. Wisdom teeth, they don't grow back once they are fully removed, or any tooth for the fact. It is not going to fully, any tooth is for a fact is not going to grow after it is fully removed. So what you may be feeling is what we call it as a bone spur or like a small root fragment which may have been left out, which you may feel like it is growing. It's not uncommon for you to have some kind of a bone spur. Many patients, and particularly when they're older, when they get the wisdom teeth removed, may have a bone spur inside, particularly on the inside, because you can't really see it, and that's when you feel like the bone is kind of protruding on the inside. You may feel like you're going to feel it with your finger, or you're going to feel it with your tongue, and you're going to say a tooth is growing. It's not actually, it is a bone spur or a root fragment. Sometimes the nearby molars or like a gum may slightly shift, like after the tooth extraction. You may be feeling a sharp piece of bone like on the side, on the behind the back molars. Could also be like some kind of a process of the healing, which the mother nature will take care of itself. And sometimes if it is a small bone fragment, the mother nature is going to push itself and your body is going to push itself. So wait, like if it is a recent extraction, wait for maybe 6 to 8 weeks. If it is not bothering, you can go back to a dentist and then get it checked out, or maybe even sooner if you are able to see your dentist sooner. Have it checked out. Do not ignore. Minor smoothing may be needed if it is a bone spur, if it is a root fragment, if it is kind of protruding bone spur. Your dentist may be able to remove it like even without any type of numbing, or even if it is any numbing required, it may be kind of a minimal numbing. That is all. It is not needed. And so it is not a new tooth, and it is most common complication after any type of extraction. So get it checked out with your dentist or the surgeon who did the procedure.
But no, teeth do not grow back.
You got it. You got it. Yeah, they do not grow back. Yeah.
All right. Dr. V, can a water flosser accidentally push an infection deeper into the gums while flossing?
The answer is no. It's very unlikely that you may be causing it if you're using it correctly, meaning that you got a completely bombed out tooth, meaning a completely non-salvageable tooth that cannot be saved. You got a lot of infection. Now you're thinking that the water flosser is the miracle. Then you keep flossing and flossing. Can it push in? Yeah, absolutely. From just by mere brushing, you're increasing what we call it as a bacteremia. You're increasing the bacteria in your stream, in your bloodstream. The same thing can by using the water flosser vigorously. Then you keep pushing and pushing, and now it is going to increase the bacteria in your bloodstream. It is possible. It can happen. Water flossers remove the debris and then they reduce the bacteria, but they are not going to completely get rid of the bacteria. Using too much pressure can irritate the gums or force the bacteria, because now your gum tissue is completely not attached. Now it is kind of opened up a little bit. Now the infection can get deeper. So use it gently. Do not blast into the deep pockets. Consult with your dentist if you have really deep pockets, or if your dentist have already told you. Make sure you're going to follow the recommendation and get it checked out with your dentist to see whether you have any active infection or any kind of a gum disease or any kind of a gum damage, and use the tool very safely, because it is a daily tool and it is a safe tool when it is combined with your regular brushing and flossing when you do not have active disease. Do not think this tool to be like a miracle when you have active disease or when you have infection in your mouth.
Yeah. All right. Can a vitamin deficiency cause TMJ disorder?
Answer is yes. Anything can cause anything, right? Can a vitamin deficiency be an indirect cause for a TMJ, what we call it as a temporomandibular joint right here? So this is the temporomandibular joint, but the temporomandibular joint, because of the vitamin deficiency, let's say that the vitamin deficiency is vitamin D deficiency, that can lead into some kind of a calcium deficiency or some kind of a magnesium deficiency. That is now going to affect the muscles and the joint here. Now it is going to cause the TMJ disorder. So deficiencies of any of these kind may worsen the jaw pain or fatigue, or even because of the jaw pain, now you're going to not be able to chew well, and that is going to cause poor nutrition, which can impact the healing if the TMJ issues are already present. So when you have TMJ issues, now you're going to cause, it is going to cause more stress. Now you're going to be clenching and grinding. That is going to mess up your bite, which are not uncommon problems from the TMJ problems. So now what you got to do is to have a vitamin deficiency checked out and have a balanced diet that supports and boosts your deficiency, and which is going to improve the joint health and the muscle health, and you are going to avoid the TMJ problems and avoid the TMJ disorder.
Okay, well, that's some good information right there.
Mm-hmm.
All right.
Okay.
How is gum care toothpaste different from regular toothpaste?
So the gum care toothpaste, specifically, as the name sounds, right? It is going to target the gum health rather than the regular toothpaste, because it is going to fight the plaque which is surrounding the gums and the gum inflammation. It also contains the antibacterial agents such as the stannous fluoride or the triclosan, which is going to help prevent or fight against the gum disease. And many have ingredients which is going to soothe the irritated gum tissue as well. So to answer your question straight, regular toothpaste mainly focuses on the cavity prevention, while you are going to get a toothpaste that is going to specifically to control the gum disease. It is also going to have some kind of a gum care formula that is going to support the healthier gums and the daily use. So if you were to select a toothpaste, select that has both the tooth care, the toothpaste, and the gum care toothpaste. So you got it all covered.
All in one.
That's what my recommendation would be. Particularly if you're thinking that you have some gum disease, so it's kind of a 2-in-1.
Okay. So basically, just get the 2-in-1.
You got it. You got it, man.
All right. So we have some rapid fire questions.
Wow. We already come to the rapid fire round already?
Yes, we are in the rapid fire round.
Okay, perfect. Yeah.
All right. So our first rapid fire question is, what are 5 things you should ask your dentist?
Oh, we actually have to go from the bottom to the top, right?
So we want to do...
Yeah, so they want to do, like, they want that to be a fun game.
Okay.
So Nirmal reminded me, my digital team reminded me, you got to go from
the bottom up.
Bottoms up, Doc.
Okay.
That's what he said.
Bottoms up. All right. So if I can only brush once a day, is it better to do it in the morning or at night?
You didn't explain, so let's make sure that you're going to explain to them. Rapid fire means like I got to answer.
Yeah, you got to answer
rapidly.
Right. So you can't drag it out.
I can't drag it out. So rapid fire. If it is 1, I got to do 1 answer. I got to 2. Like I got 2 answers. So let's start all over.
Okay.
Again.
So we're gonna start all over.
Yeah.
All right. So the rules are,
yeah,
when I ask the question, you have to answer it rapidly, okay?
Okay, got it. All right.
And only 1 answer for 1 question.
Okay.
All right. So question 1. If I can only brush once a day, is it better to brush morning or night?
Brushing at night is preferred to remove plaque and food debris and the buildup from the day.
Okay. All right. Good. All right. So we're gonna hold off on the next question. And we're going to go back to our regular questions.
No, we'll just go all the rapid fire. Yeah,
okay.
we're going to go.
Well,
we are going to finish the
rapid
and then we'll go to our regular questions. Yeah.
So you all have 2 answers for this one, okay?
You got
Still
it.
rapid though.
Yeah, you got it.
What are 2 major risks of untreated sleep apnea?
Increased risk of heart disease and higher likelihood of high blood pressure.
That was rapid. Okay. Next one. What are 3 things Dr. Vadivel loves most about dentistry? Before you answer, I know it's a lot of things you love, but we have to keep it rapid and only
3 things, right? The thrill of saving people's teeth, turning the ouch into wow when they leave my office, make it almost like a magic, and giving the people, delivering the smile, like a smile makeover. Absolutely. These are the 3 things like I love.
All right. Okay. All right. Our next one is, what are 4 lifestyle changes that can help reduce the risk of oral cancer?
Quit smoking and alcohol, healthy diet, regular cancer screenings or oral screenings, and protect your lips from excessive sun exposure.
That last one was a good one. I didn't know that. I
Absolutely.
knew the other ones, but I didn't know that.
You can get lip cancer from
I did not
sun
know
exposure.
that from sun exposure.
Mm-hmm.
All right. The next one is, what are 5 things you should ask your dentist before opting for sedation?
Can you explain what sedation is, right? Yeah.
So sedation is when you get numb for a procedure? Or when you have to get put to sleep for a procedure. So like IV sedation and things like that.
You got it. So the 5 things that you need to ask are you certified and experienced in administering sedation? Number 2, what sedation options do I have? And which is the best option for my procedure? Number 3, are there any risk or potential side effects I should be aware of? Number 4, how long will the sedation take to wear off, and how will I feel afterwards after the procedure? Will I need somebody to accompany me home? Plus, would I need somebody to watch me at home after the procedure?
Okay. So Now y'all know. And you did really good on the rapid part. So I'm
Did
proud
I?
of you. Yes, you did. You
Okay,
did. You did.
Awesome.
All right, guys. We have some more questions from you that we're going to get into.
Okay.
All right.
Okay.
Is there any mouth refreshing spray that also helps prevent cavities?
Yes is the answer. So what you're asking is there any sprays that you could be using to help prevent cavities? My answer is, first thing that you do your basic brushing, flossing, and using a mouthwash. Those are the three essential things. Yes is the answer. Some mouth sprays can help freshen your breath as well as prevent the cavities. Look for sprays that we have which are sugar-free, which we call it as a xylitol, which also have fluoride, which is going to help prevent the cavities. Xylitol fights the bacteria, and fluoride strengthens the enamel. And make sure that you are going to use a spray which is alcohol-free and which has a balanced pH. Okay, that way you are not causing more of an acid or like a base pH to alter your pH to cause some any damage. And again, as I said, these are not the replacement for the brushing or the flossing or the mouthwash you got to use, and these are supplemental. So make sure that you are going to make them as a boost in addition to the other products.
So still brush, guys, twice
Brush.
a day. Floss and use your mouthwash.
You got it. Yeah.
All right. Doc, can a dental crown cause gum issues? I had a crown placed a year ago and now my gum is swollen and bright red.
The answer is yes. A dental crown can cause gum issues, and if not properly fitted, so we call it either like bulky margins, or we call it open margins, or rough margins, or we call it as an overhang. So the overhanging edges or improper or ill-fitting edges can be a trap for plaque, and that plaque or the tartar which is going to get around these ill-fitting margins can irritate the gum tissue and can cause gum disease. It can cause swollen red gums and indicate an inflammation which is going to happen, and it can also cause infection and cause gum damage, periodontal disease, and the bone loss and all of that. To fix the problem, talk to your dentist whether they can see the poor margin, or it could be any kind of a cement that got trapped under, could be causing the inflammation or causing the gum disease, or which could be triggering the reaction, and or it could be as simple as the material that they are using could be could be causing as simple as that inflammation, or it could be very simple as you could have some kind of an allergic response to the material being used also, which could be like a rare thing to happen, but it can still happen. So the simple answer is a dentist should be able to check the fit of the crown and make sure that you don't have any of these things going on we talked about, and check the health of the surrounding gums and give you the recommendations of what you need.
Yep. All right. So our next question is, do all tooth whitening methods cause tooth sensitivity, and which ones are safe?
So not all whitening methods can cause sensitivities, but many do. Sensitivity happens when the whitening agents, or like the gels or the materials or the chemical agents, they penetrate into the enamel. So if this is a tooth, it's almost like applying a lotion that gets into your skin. The same thing, these whitening agents, when they apply it, they get into the enamel, they cause like a chemical reaction, and whenever that happens, and you get exposure of the nerve endings on the surface of the tooth, and which is what is going to cause the sensitivity. So in-office treatment, which means like the one that happens in the dental office, may cause some kind of a short-term sensitivity, but are professionally monitored, so they are much safer. But the at-home products, which are the strips or the gels that you can buy, either you can buy them from the store or you can buy them online. Some are gentler, and some could be like very harsh, because it is a very highly unregulated industry. Anybody can buy anything from online nowadays. So if it is unregulated product, they may be giving you the professionally used product, they may be selling it online. So you got to be very careful. So the whitening toothpaste generally are very mild, or the strips are kind of a milder as opposed to the gel form, because they are much slower and then they are safer for daily use. So desensitizing agents, we call it as, or the desensitizing toothpaste, we call it as, potassium nitrate can cause some reduced discomfort if you have sensitivity following these agents, particularly those milder agents, and these are safe when you use as directed. Again, talk to your dentist if the sensitivity is not controllable using these over-the-counter toothpaste, and they should be able to recommend.
Okay. All right, so we have another live question, guys. All right. This one says, is it safe to use toothpaste that expired a month ago? I always wondered if toothpaste have an expiration date.
Anything that we selling, right, in dentistry, or anything that we buy, they all carry the expiration date. So for legal purposes, we got to put an expiry date, right? So if a toothpaste expired like a month ago, possibly it is okay. You're not going to do like a lot of harm by doing that. But the only caveat is like anything to do with the medication. So we call it as the potency of the medication, right? So let's say, you got some Tylenol which expired. If it is a month after, the potency of the Tylenol is going to go down. The same thing applies to the toothpaste. So the potency of the toothpaste is going to go down because there are various chemicals in the toothpaste, and the toothpaste may not be as effective, and the effectiveness is reduced. The fluoride and the other active ingredients can lose the potency over time if you are going to use it months and months after that. Meaning you may not be protected, your teeth may not be protected as you might think, as well as they are not going to prevent the cavities as they are supposed to be. So for optimal oral health, it is best to use the toothpaste within the expiration date.
Okay. All right, back to our regular questions. Dr. V, can laser gum therapy cause nerve damage if any superficial nerves are present during the procedure?
Laser gum therapy is generally very safe, and because it is very precise, the chances of it causing any type of gum damage, any type of nerve damage is very unlikely. A lot of these nerves are like lying deep in the tissue, like for example, right in the back of the jaw, or like right up top here, or right down here. So with the laser, we don't go that deep down. So we are mostly staying within superficially. If we go deep down, we are mostly staying around the bones surrounding the tooth. So it targets the diseased tissue while sparing the healthy areas, which are the nerves, which are going to be deep down. Superficial gums in the gum area may rarely get affected, but it's not going to get severely affected to the degree that you are going to see the effects of the nerve damage. You may have a little bit of numbness following the procedure, but the numbness is going to come back. Lasers operate at, as I said, very controlled depths, minimizing the risk to deeper structures, and severe nerve damage from the laser is very uncommon and extremely unlikely. And always make sure that you're going to get the treatment done by a trained professional, meaning a trained dentist or the trained periodontist or a trained surgeon who is experienced in these laser procedures and who's also trained in the oral procedures. Nowadays, these lasers are being done even by the hygienist. So make sure that you are going to talk to your dentist or the hygienist to make sure that they are trained in lasers, using laser, to prevent these nerve damages.
Yeah. All right. If my mother has gum disease, is my daughter at risk of developing it as well?
So gum disease, it is an inheritable disease. It can go from a family, your mom or dad, to the child, and we have found, like, there is a lot of gum disease, like, we call them as twin studies. And so there are twins, like they did a lot of study. If there are twins, identical twins or non-identical twins, and here we go, we got parents and we got the two twins here, and they found like a lot of correlation between the mom or the dad or between the twins. There is a lot of like commonalities that exist as far as the gum disease is concerned. So in other words, genetics play a common role, or genetics make you prone to the gum disease or the inflammation. In addition, if you're particularly sharing utensils, it could be as simple as like a spoon, or sharing the food in between the same plate, and sharing habits like oral hygiene. Like, sometimes accidentally you use a toothbrush, which is okay, but don't use a toothbrush like a shared toothbrush, which is uncommon for people to do that. But I'm just saying that do not share a toothbrush. And bacteria can be passed through the saliva also, just by sharing the utensils. To prevent this, you need good oral hygiene and regular checkups, which can prevent this. And having a family history means that you should be extra careful or extra proactive to prevent the gum disease within the parents, from parents to the children, or if you have a sibling, then you are more prone. If particularly twins, then you could be more prone. Both of those, the twins should be checked out, or all the siblings should be checked out.
Okay. All right. Let's see what we have.
So you're going to go to a live question
Yep, we're
now?
going to do our last live question, guys. All right. So our last live question is, what could be causing a painful patch on the tongue?
The painful patch could be caused by a variety of reasons. One of the main reason is we call it as a canker sores, right? Canker sores can cause the painful ulcer or painful thing in your tongue, pain in your tongue. So that's a canker sore, which are the small ulcers that you may get, which is going to cause the pain, a painful patch in the tongue, which is not uncommon just from stress or any type of injury. Infection can cause, like for example, we talked about earlier, the thrush or any kind of a cold sores can cause the patch in the tongue. Irritation from spicy food or any type of dental products, or it could be like a mere physical object that you may be using. You may have accidentally poked your tongue, or even a toothbrush can accidentally poke your tongue, can cause a painful patch also. Vitamin deficiencies, which is very, very common. People do not know they have vitamin deficiency. That can cause a painful patch on the tongue. Allergic reactions, particularly cinnamon or any other type of food products or any type of food that you can think of. And then the trauma, like we talked about, like a toothbrush trauma or any other type of trauma, even like a hot cheese or like a hot pizza can cause the white patch. And the one thing that you cannot afford, even if you ignore any of these, one thing that you cannot ignore is the cancer of the tongue. You cannot. So particularly if you have a painful patch on your tongue, which is extending beyond the 2 weeks, then you definitely need to get it checked out, because it could be cancer also.
Yeah.
And not too long ago, we had two back-to-back patients. One of them had like a cancer of the cancer of the gum tissue, like around in the front right here, and the patient actually came in with the patch in the tongue, which happened to be the cancer of the gum tissue as well as the tongue. And then the second patient we had was a patient actually came back from with the discomfort in the tongue, also the discomfort underneath in the jaw. Both of them turned out to be cancer. This happened just within the last month, so you cannot afford to ignore that. Both of them turned out to be invasive cancer. We have to really pack bags and then send them to the oncologist. We actually call the oncologist to make the appointment for those two patients, and I hope that they both have seen the oncologist and been taken care now.
So don't ignore it, guys. Make sure you get it checked out, okay?
Absolutely. The tongue cancer is very, very notorious. Make sure that you are going to get it checked out. Do not ignore at all. Do not ignore at all. And we actually have two more live questions and two more. So let's go to those.
And do those live questions?
Yeah, let's do them because we may be running out of time. So let's do them real quick.
All right. So it says, I found out the very beginning start of bone loss on my lower mandible. My lower front incisors have recession. I'm 43 years old. Is this alarming or normal on a dental x-ray at my age?
It is absolutely not common at all. Like, you are only 43. You are only 43. If you are starting to see bone loss at the age of 43, I expect you to have perfect teeth. No matter somebody is 14 years old or 40 years old or they're 80 years old. We expect them to have perfectly healthy gum. So if you are starting to have bone loss, can you afford to lose those teeth? You can. So you definitely want to get it checked out. And if you're definitely seeing some kind of a bone loss, which I'm sure you probably figured out from your dental visit, then if they already told you you have some beginning signs of the bone loss from the dental x-ray, it is not common for your age at all. I definitely want you to get it checked out with your dentist, and so make sure that you're not going to lose your teeth. Absolutely. And again, speaking of the receding, when you have receding, you may be noticing only from the x-rays, from what you mentioned, you can only see the bone loss on the x-rays. You may not see the gum loss on the x-ray. If you actually pull the teeth and then looked into it, or if your dentist already showed you have gum loss, like the gum tissue is peeling away from the teeth, now you are at double risk of like losing the gums and losing the bone. You definitely want to get it checked out, and that is exactly what we do.
Yep.
Right?
The gum specialist right here.
Exactly. Yeah, periodontist. That is what we do for a living. We fix the bone. As we said in the beginning of the show, we fix the bones and the gum around the teeth. So at your age, if you're losing bone and losing gum, come see me if you're in Dallas, or go see a periodontist. Amen. And they are going to take care of you.
Can recession can cause the teeth to move too, right? Like
absolutely
start to be mobile, right?
So if you think about it, right? So gum receding. Now, as this person said, gum receding is making you lose gums, and because of her age, like she's already seeing the bone loss on the teeth. So now, because of the support, you're going to end up teeth being wobbly, and then they are going to come out.
Yeah.
Or they are going to go in, or they are going to come out.
Okay. All right. We have one more live question, guys. Does acid come up when we are brushing our tongue and gagging a lot, like throwing up but not coming up?
Unless you have, we talked about earlier during the show, whether you have any type of acid reflux disease, right? So if anytime you gag or anytime you even burp, right, and that's where you're going to have some kind of an acid come up. And particularly if you're prone to this acid coming up when you're burping or when you gag, and if that happens, and the acid is going to come up, particularly when you're brushing your tongue when you're gagging. So if you are not prone to have the acid come up to your mouth, and can you can you brush your tongue, gag, and will you be okay? Absolutely fine. But if you are prone to have the acid come up when you're gagging or when you're burping, then it is not okay. So do not do that. So, and maybe instead what you can do is, instead of using the toothbrush, which is going to make you gag, maybe use other tools like a tongue scraper, which is not as bad while you're using the toothbrush, which is not as difficult as using a toothbrush. And then with the tongue scrapers, you may be able to kind of maneuver things around to the degree that you will train yourself not to gag when you're scraping your tongue or when you're cleaning your tongue.
I like the tongue scraper. It goes further back without the gag.
I actually used to have one of those, like in my toolbox here. I don't have them here. I do not. So speaking of that, next time I got to remember to bring the tongue scraper. I can show them.
Yes. All right. So that's it for our live questions. So we'll get back into our regular questions. We have some time for a few more. When choosing laser treatment, can it be done for one single affected tooth, or does it have to be done on the whole mouth?
A great question. So it definitely laser can be done for just for a one tooth, or like a multiple teeth, or the whole mouth. It can be done. A lot of times we are doing it either for a single tooth, or sometimes we do it for like a single replacement tooth, which is a dental implant. So it can be done either for the tooth or an implant, whether it is a single tooth or multiple teeth, or a single implant or multiple implant. Laser can be done in a variety of ways. And the reason it can be done, it is very precise, and it targets a specific portion of the tooth, or a specific portion of the gum, or a specific problematic area. So because laser is very precise, and no need to treat the whole mouth, and if only one spot is affected, again we can use that. And it is great for localized gum pockets, like I said, because it is very precise and it can treat the infection in a single localized area. And it saves time. It saves you a lot of cost, because you don't have to wait for make things to get all the teeth or the adjacent teeth to get worse. So now we can be laser focused. That's what we say, laser focused, right? Because we can specifically treat that area, and you can preserve a lot of money, and you can save a lot of money, and you can preserve the healthy tissue. Your dentist or the periodontist will be able to evaluate a single tooth laser treatment is a good option for you, and they should be able to tell you whether it is the appropriate treatment to do.
Okay. All right. We have time for a few more. So it says, I'm 13 years old and there's gum growth on my second molar. Is that common?
Absolutely, it is not uncommon. It is common for you to have some kind of a gum tissue around, where particularly when like a molar is erupting. What that means is that the tooth has not completely pushed in, or the tooth is completely pushed in, but because you have a third molar sitting in there, third molar a lot of times never comes through it, and so you do not have the gum tissue completely uncovered on the second molar. So you may still have some gum tissue sitting around a second molar. Sometimes it could be temporary, and there could be temporary swelling, or it could be temporary while the gum tissue is still growing. And we call it as, in medical terms, we call it as an operculum. What that means is, like, it is a small tissue sitting, the piece of tissue sitting over on the second molar. And it is not uncommon in teens, and particularly when the tooth is growing. And the challenge is, it is going to trap food, it is going to cause irritation, it is going to cause infection, it is going to cause pain. So if you see that problem in your mouth, my recommendation is that you go talk to the dentist while you are keeping good oral hygiene, and while you keep rinsing your mouth properly to manage it. Talk to your dentist whether you are going to need some kind of like a procedure to help this infection and the swelling to go away. We call it as what we call it as an operculectomy. So that means we are going to remove that small piece of tissue. Sometimes we use a laser. It could be as simple as a quick procedure. Even without the numbing, we can apply some numbing gel to be able to get that procedure done, a simple procedure done. So see your dentist, and if it is a painful, swollen, and bleeding.
And tell your parents too. 'Cause you're
Absolutely,
13.
yeah, correct, yeah, correct.
Well, that is our time, guys. We really enjoyed reading your questions and answering your questions. Until next time.
Thank you all, and we will see you next time. Thank you very
Bye.
much. Bye, all.